Moving on to partnership, which is thrown out a lot, and we often talk about collaborations, which can be kind of squishy. And Paul, you alluded to this. The words in this space, partnership, engage, those are words that we use in relationships. And if you think about it, you don't just walk up to somebody and put a ring on their finger, right? There's a whole lot that goes on before that. That pre-engagement stage is really, really important. But if you get to that point of putting a ring on the finger, you can have really great outputs. How do partnerships improve quality and better adherence? And I throw that out to you, Andy.
Oh, to me?
Yeah.
I was thinking I'd like to hear what he's saying about this. Well, I was just thinking of the example that we just heard, which was around how do you get 20 minutes with a patient to get them to better understand or to better align with compliance or regimes and protocols. So let's use a real example in terms of partnership in Portland, Oregon. We take care of a fairly large segment of the Medicaid population, okay? And in fact, if you read Philadelphia's newspaper this morning on the editorial page, you'll find out that the population in this city that is under the poverty level is 25% plus, okay? And if you think about the number of babies that we have born in the state of Oregon that are Medicaid patients or babies, it's close to 50%. And I would say that these numbers are not going to go away unless we start to think about ways that we can better partner in our communities around giving the health and well-being that all of us enjoy to these vulnerable populations. So partnerships around social determinants of health is something that I think this group should explore in much more thoughtful and detailed ways. The example here is that we take care of a population in the Medicaid population and across our various spectrums that are dealing with the chronic illness around mental health, psychiatric diagnosis. We also have populations that are vulnerable as it relates to their housing and their homelessness as a result of their illness. We have just partnered with all of the other care delivery systems in the Portland metropolitan area to create, along with the local counties and the state, to create 400 units of supported housing for these patients that will provide them with a supported housing environment, with a care treatment so that those individuals that need the 20 minutes or 30 or 40 can get it so that we can keep them out of our emergency rooms and off our streets. Now, we're not going to completely fund this. We used our position as a partner in terms of funding to attract other funders in. It would be a great opportunity if you're looking for ways in which pharma can come in and partner with important efforts that everyone in the community, regardless of where you sit on the partisanship kind of space, something that desperately needs to come together. So these are, and the social determinants of health transcend just the prescription, the script, and are a great opportunity for us as an industry coming together to treat and to partner with our patients and our communities.
I think what you just described from a patient perspective is the future of health. In the United States, we spend more money on health than any other country. We have some of the lowest outcomes. And yet when you look at how much we spend on the other social determinants of health, housing, transportation, food, education, we actually rank really low. How are we surprised that our outcomes are not good? How are we surprised that people aren't compliant and adherent when they don't have food or a place to live? Huge challenges, and I think we have to start thinking how we integrate those services in a very, very different way. So I think that's an exciting point.